Any slides? Thanks very much. This QR code was hastily worked up so it takes you straight to the report. This is a report that we've done as a charity report, so it's not an academic piece of work, it's a sort of status report, snapshot report of how things are at the moment. Can I have the next slide, please? Or can I click? Is it the Z button? Oh, great. I want to acknowledge co-authors and contributors, and just to say that they're all volunteers, they've all got long COVID, they were all unpaid, apart from the designer who created the report, but we kind of feel we shouldn't really have to do this work. We've done it because it needs doing, but NHS England should be doing this, or DHSC, somebody should have the responsibility of knowing what's going on, and I understand NHSE did do this sort of stocktake thing, but they're not going to publish it. So we used 3 different pieces of information. We did a community survey. That was from people in our long COVID groups, long COVID support and long COVID kids, because this is collaborative work with long COVID kids. So we've got 520 adults and 182 CYP. So this is our population who already think they've got long COVID and are seeking help for it. So it's a specific sample. We also looked at FOI, so we did FOI requests to every ICB and health board in the UK, and a lot of trusts, over 200 trusts. And we did a deep dive into referral patterns in Derby and Derbyshire. The only reason for that was that a couple of our members lived there and took part in a consultation process about the service and gathered some data for that. But it's a good exemplar for a lot of ICBs, I think. So I'm not going to go through all the results because of time, but I wanted to pick out ones that I thought this audience would be interested in. So we've got low awareness. Now, I remember, as I said, this is a group of people who are already interested in finding out about long COVID. They're in a support group. And 28% of adults and 61% of CYP didn't know of the existence of any specialist services in their area. And some of their GPs also didn't know. We think that there's quite a lot of fairly ropey care out there, from what we can figure out, if I can use that word. And there's a lot of services are falling short of the commissioning guidelines. Now, the NHSE commissioning guidelines that Mel referred to in the beginning are great, and I know a lot of people here wrote them. If all the services adhere to that, it would be great, but they don't. They really don't. And 28% of adults and 26% of CYP had not had any type of consultation with any clinician at all, either remote or in person. Some services consist of a course or a video. There's a concern over lack of follow-up, so a lot of patients felt they've had the kind of standard course, or they've had everything that's available at their service. They're still not better, but they get discharged anyway because there's nothing more the service can do for them, and we know that especially in some services are a therapy hub, they're a signposting service really. They're not what most people think of when they think of the word clinic. And I know that that's lack of funding, lack of local resourcing and so on, and staff would like to give a fuller service but they just can't. But patients find that very inadequate, and there are a lot of people who are just kind of left to go back to their GP. The GP doesn't know what to do either. We asked about satisfaction with services. Now, what I want to focus on here is the green bits. The green is 4 and 5, where 5 is very satisfied, completely satisfied, and 4 is satisfied, 1 is completely unsatisfied. Now you can see there's a lot of red and orange for both adults and CYP, but there's green as well. There's some really good services, there's some really good practice out there, and what I wanted to say is we want that to be disseminated, so we would like the really good practice to spread to the others, and that's what this meeting is about, largely as well. So when long COVID services are good, they get a really high rating, and this quotation from this person here includes a lot of the elements that people really, really appreciate. So they're keeping up to date with research, they're sharing other people's experiences, they don't encourage them to push through, they don't suggest it's psychological in origin, and they have a choice of type of appointment. We also asked a specific question around NHS overall. So for those people who had used services, we said, how did you find the services? And then for everyone, for the whole sample, we asked, how do you find services overall with the NHS? So that would include your GP, maybe some other specialist referrals you've had. And there's, again, a lot of red and orange. But for the adults anyway, there's quite a difference between those who had used services and those who hadn't. So we disaggregated it from the people who hadn't used a long COVID clinic and those who had. And satisfaction with the NHS overall is higher for those who have access to long COVID service. So I think that says quite a lot about the long COVID services and the need to have them and the improvement in patient experience. For the CYP, there's a slight difference, but not so much, and it's really quite small numbers. So we didn't really delve into why that is. So what patients want, I mean, this list is not rocket science really, and I don't think it's going to surprise anyone. They want compassionate, knowledgeable professionals, physician-led care, and I think this is quite key. A lot of services are therapy-led, and therapies are obviously completely essential, but I don't think they should be a replacement for the physician, and especially with pharmaceuticals coming down the line from research. You need a prescribing physician. It's a medical condition, it needs medical treatment. They appreciate referral pathways, PIFU and so on, research-informed treatments, personalised care, we've heard a lot about that, and choice of in-person or virtual appointments. What they don't like is kind of the opposite of what they do like, but